Good afternoon. Welcome to our press conference today. My name is Diane Marseglia, Chairman of the Bucks County Commissioners, and I am here with my fellow commissioners, Bob Harvey and Jane DiGirolamo. We are also joined by Dr. David Damsker, who directs our health department, Gail Humphrey, our clerk, and Larry King, our Director of Public Information. So we're glad to have you. We will jump to questions pretty quickly after we just each get to make a little bit of a statement. What I wanted to say is, there's been a lot of talk and worry and feedback we've been getting about the schools and from the schools as everybody decides how they're going to go back to school in September and if they're going to go back to school. So we wanted to be as helpful as we could, and we are able to say today that we are committed to the school districts as well as to the private schools in the county that we will buy each student a face shield. We think this is a great way for them to all start off together with that same protection. We know that there's been a lot of worry about wearing masks, and for people who can't wear masks, but virtually everybody can wear the shield. But more importantly, it allows the teachers and then their peers, everybody to see each other's mouth when they're speaking, and it allows the students to see the teacher's mouth as well. So we are pretty hopeful that this is going to be a big, comfort step for everybody as we get adjusted to the idea of going back to school. So we're proud to be able to do that. They are being made, I believe, as we speak. And so we will make arrangements to get them to all of the schools, and the schools will be in touch with the parents. So passing this off to Commissioner Harvey, do you have any introductory remarks?
Yeah, thank you. Just want to touch on just a few things. The Bucks Back to Work grant, the money, the roughly $14 million that the county is granting to small businesses, about a little over 900 businesses. About more than half of the businesses have received or the funds have been mailed out to them. For those businesses that are getting grants, they were contacted or are being contacted by the county to provide some information that we need. We do eventually every year have an audit here in the county, so we have to make sure that all the funds that we disperse, that there's an accounting for them. So some information has to come from the business back to the county. Once that information is entered, then by the controller's office, then the treasurer's office actually cuts the check. So we're moving through that. And I was talking with some businesses last night who were very appreciative, and we're doing our best to do what we can to help. Just a reminder that the county does have its economic resources page still up. And that is through the COVID-19 page. The Economic Resources Portal has links to businesses in Bucks or right outside of Bucks County that make PPE or make hand sanitizer, things you might be in need of. There are all kinds of guidance. There's all kinds of guidance on there from federal, state, and local for your business. If you're looking for guidance, it has been updated based on the governor's announcement last night about restricting occupancy inside places like bars and restaurants and those kinds of things. So we have updated it accordingly to make sure that it's as accurate as possible. And one other thing, just to finish with, we've gotten a list of companies all over Bucks County who have been following the protocols really well and have really kind of are sort of the model citizens of how to do a COVID safe operation, no matter what kind of business they have. We are starting the process of highlighting those. I visited one last week in Lower Bucks County, 225 Lincoln Properties, and we posted on the Facebook page here, the county page, some photographs of that visit and talked about some of the things they did. Going to another business next week. So we're lining up visitations to different businesses, really to show people that there's some really good practices being done by our neighbors and by businesses in our area, and thank them and recognize them for their efforts. So we know how important it is to keep masking up, to keep safe. We want to make sure people are aware of the businesses that are doing that. So thank you very much. I'll turn it back to Commissioner Marseglia.
And I'll turn it right over to Commissioner DiGirolamo.
Thank you, Diane, and thank everybody for joining us today. This COVID has really presented a lot of challenges for many of us. And again, I keep saying this, that I think we are doing a good job here in Bucks County in trying to manage and what's going on. But I think it's important to get the message out that there are an awful lot of states out there that are not in as good a shape as Pennsylvania is. And I know you've been following the news, you know, that Florida had one day over 15,000 new positive tests in one day over the weekend. In Texas, California, Arizona, there is a list of states that the governor and our State Department of Health have listed that they think are like hotspots for the coronavirus. And they are advising residents, not only here in Bucks County, but across Pennsylvania, not to travel to those states. And if they do, if they absolutely have to, that when they come back to Pennsylvania, that they should quarantine for 14 days. So I think the message that we have to get out is that if you're a Bucks County, Pennsylvania resident, and you're thinking about vacationing in one of those states or going there for a business trip or for whatever, to seriously consider not going. But if you absolutely have to go, I think it's important when you come back to Pennsylvania to protect the residents here that you do what the state is asking you to do and quarantine for 14 days to make sure that you're not spreading the virus around the community and where you live. But I think that's a really important message to get out there. And again, thanks for joining us. And I'm going to turn it back over, I guess, to Diane, Commissioner Marseglia.
Okay, and Dr. Damsker, thanks, Jean. Dr. Damsker, do you have any opening remarks?
No, I think there's a lot of questions. I'll probably get to most of my remarks in the question session. Yeah.
Okay. Gail, did you have any remarks or any information that you wanted to share?
I think the same as Dr. Damsker. I think there's a few questions. I'll answer them when Larry asks them.
Okay. All right, Larry, we're ready.
All right, Commissioner, thank you. First set of questions is from Deanna Durante of NBC. She was wondering if there's any concern about delays in the testing process for COVID. We're hearing that it's taking 7 to 10 days for some people's results to come back.
Yeah, there's a little bit of a concern depending on where you get your test. Right now, the laboratory that has the longest wait is probably Quest. That's a national lab. They are being swamped by other states, as was mentioned earlier, Florida, California, Arizona, and their turnaround time has dropped. We've had some cases that took so long to get their results back from Quest that they were uninfectious and clearing them from isolation by the time they got the results back. So they did their entire isolation waiting for their result to come back. That's not happening every day all the time, but we have seen cases of that. So obviously Quest needs to figure that out on a national basis on how to increase their testing capacity, because a 10-day turnaround for coronavirus is simply not acceptable for many reasons in a public health perspective. But that's just that can't continue. So I'm hoping that they fix that. LabCorp has been better. We have some local laboratories here that are able to do the turnaround in a couple of days. And then the hospitals, again, if it's truly critical, the hospitals, 5 over 6 hospitals have rapid testing capability. They can do for ill patients in ERs and people that get admitted. So there is the capability if someone's really sick to get those people tested quickly. But yeah, if you're someone who's just going to a random place to get tested, the turnaround time is slower today than it was, say, a month ago. I do think it'll get better. I think we've sort of seen this sort of an up and down thing a little bit. Now that we've identified the problem, we're hoping that the capacity is re-upped, and over the next couple of days, we'll start to see those turnaround times come down. But it does make it difficult in certain situations where, if you're not sure you have it, and it takes you 5, 6, 7 days to get your result back. That's not optimal for many reasons from a common sense perspective. But it's not happening with all results. We still have plenty of people who get results back in 1 day, 2 days. But there are situations where it's happening. So we hope to avoid that going forward.
Thank you.
Okay. And also from Deanna Durante for the commissioners and Dr. Damsker, were any of you consulted before the governor imposed his order yesterday? What impact do you think that it will have on businesses that are already struggling And will the county be awarding any assistance to restaurants and bars?
So very quickly, I don't believe anybody was consulted beforehand. And certainly I am concerned about restaurants and bars. They just have only had a few weeks to kind of recover, but they will never recover if we don't keep the count low. If we ended up back in red again or people sick, we just can't take that risk. Commissioner Harvey?
No, we got an email from the governor's office a little bit before his conference, just kind of alerting us to the fact that there was a press conference that was happening, an announcement, and an idea of what it was going to be about. And I echo Commissioner Marseglia's point. Certainly, we want every business to be up and running, full speed. But the fact of the matter is that the virus is in control right now, and until we have more of a handle on it, until we can kind of get some better practices, in some places, it's best to err on the side of caution.
Yeah, I don't have anything new to add. Again, we did not get a heads up. Certainly, I'm very concerned about our restaurants and them being able to operate. But we're, right now forced to follow the guidelines that the governor laid out yesterday. And, hopefully in a week or two, or maybe even 3, we'll be back in a position that maybe we can, the restaurants can go back and open up like they were before what they are now.
Yeah. And if I can, I forgot there was a second part of that question about aid to any bars or restaurants from the county. There were quite a few restaurants and bars on the list of 900 or so businesses who got grants. There is a state grant program right now that is in operation. I think the deadline's pretty soon to apply for that. And that information is available through the state website. We are considering a second round or another round of funding to small businesses. But we don't have anything immediately ready to go to directly help restaurants and bars at this time.
And I just want to add one thing. We have spent a lot of time going out to bars and restaurants over the last few weeks since they were able to reopen. And the majority of facilities were absolutely complying with what we're asking them to do. We have had a few that, were allowing people to not socially distance, and we were at those facilities weekends, nights, and we, made some inroads with them, and we were able to make some changes. I want people to realize here in Bucks County anyway, we always have a case or two that someone says they went out to eat. We haven't had really too many outbreaks associated with that, but this order wasn't really about Bucks County per se. This order was about what they were seeing in Allegheny County and other similar counties where they were seeing outbreaks in bars. And overall, the Bucks County, if it's happening in Allegheny County, it's certainly capable of happening here in Bucks County. I think the governor decided to say, if it's happening in multiple counties, it could happen in Philly or Montco or Bucks anywhere. So, I understand why he did what he did. I do think it punished a little bit. There's some facilities that really went all out, spent a lot of money to make sure that the seating was done appropriately and everything else. And they're still allowed to open. And I think there's some restaurants that have done really well mixing in outdoor dining, mixing in the takeout that they were able to do. And so some of the restaurants are hanging in there. Some of them are going to be a little more it's going to be difficult for them who don't have a way of having outdoor dining or aren't really set up for takeout that well. But a lot of them are changing the way they do business. And I do know though that, and I've said this for weeks, the governor didn't just make this up. I mean, there's real risk to alcohol being served in bar areas where the social distancing is not occurring. We've seen issues at, people are having parties at their houses and they're not social distancing. So it's not just about bars and restaurants. 4th of July parties can be issues as well. People think because they go to a friend's house and there's people there they don't know, well, it's at my friend's house, I can't get coronavirus at my friend's house. Well, I want people to realize that you can get coronavirus at a friend's house, especially if you're with people that you don't know. If there's alcohol involved, you're not social distancing. So I think that some of the bars and restaurants were doing a really good job, and I do feel badly for some of them. And even the ones that started off a little rough, we were getting them into compliance. But this is an order he had to make on a statewide basis. And I certainly understand that this is one of the higher risk, areas that he was trying to address. As they said yesterday, it was more of a surgical approach rather than a large scale approach with multiple things. So, but on the whole, Bucks County restaurants and facilities are doing a good job abiding by what we've asked them to do from social distancing and other guidelines, things like that.
Larry?
All right. And along those lines, we're hearing that there's going to be another pronouncement this afternoon from Governor Wolf's office. So the question is there any idea at this point if the state or the Department of Education will be issuing new school guidelines that could impact the plans that are already being made in Bucks County?
Nothing.
Yeah, we have not been told anything directly. What I'm hoping, though, is, the guidelines that we've put out here in Bucks County are pragmatic. They're able to keep kids safe, we believe. The big deal is about 6 feet, 3 feet, and I won't get into the whole science behind that, but there are no guidelines anywhere that require 6 feet and masking to occur. Even the CDC guidelines, which are held up as the national standard, always say 6 feet when feasible, if possible. We're hoping that the governor, at least I'm hoping certainly the governor, will be realistic and say, yes, we all say 6 feet is a little bit better. It's better than 3 feet. And if a school can aspire to that and make it happen while also reopening, that's great. But we know that most schools in Bucks County can't do that exactly at 6 feet. But the universal masking order that the governor put into place should allow schools to be able to reopen if they can't quite hit 6 feet, if it's 4 or 5 feet, whatever it ends up being, that they should be able to reopen safely. And I'm hoping that message does come out later today, because it's a real game changer. If you were to require 6 feet and masking, that would be far in excess of any requirement, anywhere.
Okay. Thanks, Doctor. From Tom Sofield of Levittown Now, we have some questions. With the new COVID-19 measures that were announced yesterday by the governor, does the county plan to alter its operations, like having more staff work from home in the short term?
Short term, we have still allowed some staff to work from home if their job is totally, virtually capable, but we haven't changed any new policy. I don't know if Bob or Jean have any feeling on that, but sounds quiet.
Gene, I think the policy we got in place has been working pretty well. We haven't had any problems from what I can see, and it's been working pretty well. So it would be my hope that we just continue the policy that we've been employing as of now and not change anything because of the governor's recommendations.
Okay, Larry.
Also from Tom Suffield, many business owners have said that there are some gray areas involved in the new mitigation measures. Has the county received any clarifications or submitted any questions to the governor's office about any gray areas that they see?
I can tell you that normally when the governor puts out a new order, a lot of questions get answered a couple of days later. That's sort of been the modus operandi, when the governor put out the masking order universally. A lot of people say, oh my God, it's not clear, it's not this, it's not that. And then usually about 2 days later, an FAQ comes out that explains a little bit more detail about some of the gray areas that you're referring to. The orders just came out yesterday afternoon. We have not gotten any clarification other than what, we have received in emails and that what he's put out on his own website, So we are waiting for additional things. A great question would be, for instance, a bar, that doesn't have a kitchen. But if they order pizza and have pizza delivered, is that considered a meal? I mean, there's a lot of things that we have to know as the licensing agency for these places. Those are the kind of questions that we would have, and we're waiting for additional guidance on, what a bar can do. For instance, it doesn't have a kitchen normally that's just serving alcohol. Can they remain open if they do other things? But we do know that you can't be seated at a bar, so you have to be at a separate table. So there was some clarity given, but we do need more And I also believe the Liquor Control Board will hopefully be available. They have agents that we go out with sometimes that can help us with some of that. But overall, I think that yeah, maybe some frequently asked questions. We're pretty confident that weddings, for instance, which is a sore subject for some, especially those who are about to get married. If you're getting married inside, that's now a gathering of more than 25 people. So that means that pretty much all weddings will be off going forward, if it's inside anyway. So those are just some of the things we want to just make sure are clarified, before we tell everyone they can't have any weddings. But I think that the governor sometimes, in doing his best, doesn't realize some of the unintended consequences that the counties, that not just Bucks County, but everybody has to deal with some of these orders. And I think that usually after a day or two, they kind of compile some of those concerns and questions and get them out for people to see.
Okay, and I think you spoke to the mitigation compliance earlier, but specifically, has the health department been forced to close or take any action against businesses that have been operating in defiance of the orders?
We've had a couple of situations where we had to we have a regulatory fee that we can issue on someone if we had to come back a second time to fix something. It goes up a little bit for the third time if we have to go out, and then in that case we get the Liquor Control Board if it's a restaurant or bar with a liquor license, or depends on depending on what the facility is. But for the most part, I'd say 95% of our facilities have been doing what we've asked them to do, and have done a really good job and have spent money retrofitting certain things to be safe. And again, I want to make sure everyone's aware, the governor wasn't penalizing Bucks County when he made this order. I think we've done a really good job here, but we're just kind of thrown into the mix because he had to do it on a statewide basis. But I don't want anyone thinking that this order was done because of what's happening here. It's much more of an issue in the southwestern part of the state, in Allegheny County, where they've seen real spikes in cases there.
Thank you. Some questions from Todd Shepard of the Delaware Valley Journal for Dr. Damsker. You were among the first to lay out criticisms of the original metric of 50 cases per 100,000 individuals over the course of 14 days to progress from red to yellow. And it appears that the Wolf administration essentially abandoned that metric later. With the new restrictions imposed by Governor Wolf yesterday, do you know what metrics they're looking at, and do you agree that they are the right metrics in making this new decision?
They have not released publicly any new metrics that they're looking at. I agree with what they're doing. If they see outbreaks in a certain type of situation or facility where they can make different rules or strengthen rules on a certain issue, that's the way it should be done. Again, I've said this before. The numbers of cases doesn't always matter. The best example I can give is right now our hospitalization rate. We're down to 26 people in the hospital, which we haven't seen since March. So it's the numbers of cases aren't as important as the hospitalizations, or if we're seeing large numbers of community spread, those kinds of things. So if they've seen, and we don't have access to what they see at the state level. So if the state is seeing many outbreaks tied with bars and restaurants in other places that they've seen, they've decided, because they've seen those outbreaks, to make a decision. But I'm hoping that they're not looking at a case, and we're still under that 50 case per by onset date anyway. But, I would hope that they wouldn't look at a straight number to make any decisions, because it's such a fluid situation. You have to look at the entire situation in context and not say 50 cases per 100,000 or 40 or 60. It's about who the cases are, where they're getting infected from, and if there's a specific risk factor that seems to be popping up, you handle that and not make large sweeping pronouncements.
Okay, and a follow-up also from Todd Shepard. The state has also pointed the finger at the recent uptick in cases at 3 issues. Number 1, not enough of compliance with mask wearing. Number 2, out-of-state travel. And number 3, lack of national coordination. Do those causes match up with what you're seeing in Bucks County?
Well, I'm down here in sunny Florida right now. I'm not sure what's going on, but no. But no, we've definitely seen an uptick in out-of-state travel. And I know when we put out our press releases a few times a week, we try to mention that we absolutely saw cases from Myrtle Beach, Florida, Texas, Arizona, Delaware. We've seen some from the Jersey Shore even, which is not on the quarantine list, but it certainly has been the source of some of our cases. And, we've seen a couple of cases of household spread from those cases. So we've seen second generation cases now. And what happens is eventually is the second generation turns into third generation, fourth generation, and that's how you get community spread from someone who traveled out of state. So yes, we've seen that as an issue here in Bucks County. And we are, obviously recommending that people, be very careful when they go to places, because a lot of people that we've spoken to that have traveled out of state were not being real careful while they were there. They had parties at gatherings, doing different things, and those are risky things anywhere, but especially, at some of the areas that have higher prevalence than here in Bucks County. So that's one thing. The second issue you said was, I know the national thing. What was the number one on there besides out-of-state travel?
It was mask wearing.
Mask wearing, yeah. I think, you're never going to get 100% compliance with mask wearing. I mean, there's certain people that have medical conditions. There's certain people that will refuse no matter what you say to them. But I've seen most people wearing masks in most situations. And I believe that that's what we need to see. I feel good about it. Wherever I go, the vast majority of people are wearing masks, if not everybody. And you see a few people, obviously, if you're out, outside, there's less masking, which is okay. If you can social distance, we don't expect you to have masks. But if we have issues in any of our facilities, in restaurants and bars, we've made real sure that they're doing that. And to be honest, most of the places that we've gotten complaints about, when we get out there, the staff is wearing masks. So it's not always about the staff. Sometimes it's about the patrons at the bars and restaurants that we talked about earlier. But again, I feel that masking does work, and we know that if most people wear it most of the time, you're going to have a really good effect from that. So I don't want anyone, in Bucks County to freak out. They see one person without a mask, because it's not going to make a difference on a large scale, because most people are doing it most of the time. And I think that's a really important concept to remember about masking. From a national perspective, if there's anything the federal government can do to increase capacity at labs like Quest or other, and that would be obviously helpful. The state is sending out, or the federal government is sending out, these new antigen tests to multiple nursing homes throughout the country that are in certain situations where they have higher caseloads. And so we just got that information the other day. And this new antigen test, technically you can't call it a case yet because they haven't changed the case definition, but it's a pretty good test, not quite as sensitive as the PCR swab, but it can be done as a point of care test, like a rapid strep at a doctor's office or a rapid flu. And hopefully these machines, as they get used more and more in common sense, practical applications, and we have more data coming out, that could be sort of the answer to a lot of the issues that we have, that you could do something on a point of care basis. They can get results back in minutes while you're standing there waiting, like we do in doctor's offices now for flu and strep. And I think that would be a real game changer nationally if in fact these antigen tests do work and can show promising results. And maybe those multiple companies can start making. I think only 2 companies make it, which sometimes isn't enough to get it out nationwide. But that will sort of be a game changer from a public health perspective all the way around. If you can go to your doctor and get a result, within a few minutes, or go to CVS and they can test you in a few minutes, and that would make a lot of things easier in most situations. So that's where I would like to see the federal government focus their time on, is because we know the PCR test, the swab, has there's pros and cons to it. The antibody test clearly has pros and cons to it. But the antigen test would be a really nice thing nationwide that would solve not all problems, but a heck of a lot of problems involved with it.
Okay, and one for Dr. Damsker from Chris Ullery of the Intelligencer. Governor Wolf said during yesterday's press conference that the changes would effectively mean that bars that do not serve food would effectively be shut down. Would it be up to the county's health department to enforce that rule, or would that fall to some other agency because there is no food service? I would think that this might be a state liquor control board issue at some point.
But alcohol is food. according to state. So we license all bars, whether they serve food or not in Bucks County. Obviously, having liquor control agents with us, it makes it easier. That's sort of the be-all, end-all. If you lose your liquor license, you can't operate. But again, there's some questions that need to be asked. Can a bar, as long as you're not seated at the bar itself, if they do have tables that are able to be sat, could they have food brought in? Could they do things? Because those questions are going to be asked. If I was the owner of a bar, I would be asking those questions because I would want to try to stay open in some way. So I think that needs to be clarified. Or do you have to have a kitchen making your food on site? And those are the questions that we just don't have the answers to. This all just came out yesterday, and so I think we're waiting, and we can certainly ask those questions as well and hope that they get answered soon. But we do license bars that don't serve food, and we would be the licensing agency, and we can also, of course, as I said earlier, we can get the liquor control agents involved as necessary if required.
Okay, have a question for Gail Humphrey. Was there an option for mail-in voters to automatically request a mail-in ballot for November's election when they applied for a ballot in the primary? If so, is there any idea on how many Bucks County voters have already asked for a November 3rd mail-in ballot?
Yes, that was an option. And in the primary, we had 100,000 people apply to do mail-in. 78,000 of them sent ballots in. Of those 78,000, 63,603 have asked to become permanent mail-in voters.
And also from Chris Ullery for Gail and the commissioners, have there been any updates on legislation giving the county more time to count ballots or any other changes to the mail-in system that might make counting easier in November?
From what the research we have done here at Bucks, it looks like they have about 3 bills in place. The legislative language they would use is say vehicles. So they have 2 bills that aren't very substantive right now and one that does have some substance to it. But it looks like in the state house that they have a number of bills in play. The conversations we have had with the state Senate sound like maybe it's a little bit off in timing. I don't think it's going to happen in very, shortly. There may be some changes that come about by the fall, but we're very hopeful. The things that here in Bucks we would like to see is we're hopeful and hoping that they would push back the time frame from when someone can apply for a ballot to when the ballot has to get back to us here in Bucks. We had that problem in the primary. You could apply up until May 26th, but the ballot had to get back here by June 2nd, and that didn't allow much time for the mail system to work, so we're hoping they will push that back. We're also hoping that they'll allow us to canvass, which means prepare the ballots, not actually tabulate them, much sooner than we're allowed to do now. And we are asking that they put the ballot boxes in law because we think they're really helpful, especially here in Bucks and Montgomery County and the surrounding 5-county area.
Commissioner DiGirolamo, did you want to weigh in on that since you're in charge of our?
Yeah, I mean, Gail did a good job of, explaining what's going on. The part that they have 2 or 3 bills in the House that look like they're bills that aren't very substantive, that could be amended on the floor of the House or in committee to insert language that would change the state laws that would allow the counties to have a little bit more time to count these ballots. I think it's important to understand, although there's 67 counties in the state of Pennsylvania that have to abide by the same rules. I mean, here in Bucks County, we're a county of almost 640,000 people. And there's other counties that only have maybe 50 to 100,000 people. So their problem of counting the ballots are not as severe as what we have here in Bucks County and southeastern Pennsylvania and some of the other larger counties around the state of Pennsylvania. So, we submitted a letter a few weeks ago, the task force that we formed here in Bucks County, to come up with recommendations of what we would like to see changed in state law. We submitted that letter to the chairman of the House State Government Committee. I believe it was also passed on over into the Senate. So they are aware up in Harrisburg of what changes we would like to see happen. to make it easier for us here in Bucks County and other counties around the state to count the ballots in a timely fashion. And also we came up with recommendations to make them more secure and maybe have penalties if anybody would do anything that would abuse the process. So we've submitted our recommendations up to Harrisburg. If they're going to do something, it's got to happen probably end of July or the first half of August to be put into statute and law to help us in November. So we've given our recommendations. I hope there's some changes that they make. I really do, to make it easier, not only for us here in Buck, but many other counties, to make sure that we're safe and secure and everybody who wants to vote can vote, and make it as easy as possible for people to vote.
Thank you, Commissioner and Gail. I think we've covered this, but just to make sure, a couple questions from Marion Callahan of the Intelligencer, who is planning to cover the Governor Wolf's press conference later today about school reopening plans. She's asking whether we know whether the plans to be announced are consistent with the county's recommendations. And I think we've said that we don't know what the word is going to be. Beyond that, Marion says she's hearing from districts that Dr. Damsker's recommendations are different from what the governor may be recommending, and wants to clarify if we know what any of those differences might be. The one example that she's hearing is the recommendation that Dr. Damsker made for 3 feet between students being adequate, not 6 feet.
Yeah, remember, our recommendations are as close to 6 feet as possible, and I'm hoping the governor makes those same recommendations. The 3 feet was the absolute minimum, which is the WHO guidance, which is done in many, many countries around the world. Successfully, it was done, and it will be done going forward. When the schools reopen in those countries, it's based on the concept of droplet spread being the main driver of spread. And when you cough, talk, or sneeze, most of the large droplets do fall down within 3 feet. And again, 6 feet can be a little bit better for sure. And the 6 feet idea is sort of a pie in the sky, because we know that most of our districts can't reach that. And we do know that there's evidence that shows, good evidence that shows, that the majority of droplets do fall down at 3 feet. So yes, it's a little bit better at 6. But when you mandate 6 feet and masking, our school districts will not be able to have a full reopen if they do that. So I think the governor most likely will be saying that we like 6 feet, if possible, when feasible, because that's what CDC guidelines say. The American Academy of Pediatrics says 3 feet's okay with masks. So I mean, there's a lot of evidence out there that it can be done with safer distances than 6 feet, especially when everyone is universally masking, which we will be in Pennsylvania when schools start in September.
Okay, follow up on that from Jim Elward of KYW. He's asking the question a little bit different way. What are you hoping to hear? And would you prefer that the state leave it up to the counties and districts to decide best practices for their schools?
Yeah, I thought that the state, did a good job earlier on when they said, they gave a template of some generalities that everyone has to follow a health and safety plan for each school district. I think the one weakness of that is not every, school district in the state has a local health department. We're lucky we have one. There's 6 counties, municipal health departments. There's also 4 municipal health departments that can assist. But there's a lot of counties in the state that don't have a health department to sort of rely on, and they're relying on the state health department. So, I know my guidelines sort of made it out there statewide in a lot of ways, just to have something to look at. And maybe the state now is saying, hey, there are some school districts that that don't have a local health department to consult with. So they may be putting out guidelines that would be that each of those health departments, that those school districts can use, in the absence of having to follow someone from Bucks County, which is across the state. So I'm hoping that the guidelines are pragmatic, keep the kids safe, and are not too dissimilar from what Bucks County schools are looking to follow, because as I said earlier, the guidelines that we're following have science behind them. And if you get too strict, you basically hamstring the schools from being able to do what they need to do to reopen schools in next month or September.
I'm going to jump in on that one. I just wanted to say that, we're all hoping that everything goes well, but part of that question was, did we think it should be up to counties or school districts, not across the state? And I guess I am hopeful that it would be up to counties and school districts. If there is a difficulty in the southwest part of Pennsylvania and we're not having any problems, I would not want us to keep the kids home from school. So I'm hoping that it's at least by county, preferably by school districts. If you look at Ben Salem and Quakertown and Bucks County, they're far enough apart. I'd also like to say Dr. Damsker's recommendations, while they are exactly what we need, they are the minimal standard. We have not been asked to give a maximum standard here. So any school district that wants to do something more than that is welcome to do it. But our job is to make sure that they don't go below that standard at any point.
Thank you, Commissioner. Also from Jim Melwart, he's wondering how our contact tracing is going. They heard a couple of examples of lack of cooperation with contact tracing going on in Montgomery County yesterday, and was wondering if we're encountering anything similar here in Bucks County.
Yeah, well, it's interesting because we have real good data because we've been contact tracing the entire time. We've seen actually 3 small bumps, which is interesting. We saw a bump after Easter. We saw a small bump after Memorial Day, and now we're seeing a small bump after 4th of July parties. And there's some reasons behind that. Some people, they went to someone's house for Easter. They didn't want to say that they went to someone's house for Easter. They may have gone to a Memorial Day party, didn't want to say. And the same thing's happening here on 4th of July. We've had a few people that have, I would say probably more than we've had before overall. People that we call them on the phone and they say they'll give us some information about themselves, but they don't really want to talk about maybe everyone else in their family or where they went. But I would say, a solid, 90+% of people are very cooperative, give us the information that they need, and they're doing what we asked them to do, which is what needed, because this whole thing kind of falls apart if people start becoming selfish or hesitant to tell us information that we need to know. We need, if people need to be honest with us so we can do the actual contact tracing, and, we need to know where they've been, because if someone went to a bar or a restaurant or whatever, we mark that down. And if we get another case the next day who went to the same place on the same day, it allows us to actually make decisions that we can stop the spread. But the vast majority of people are very cooperative, do what we ask them to do. And we've seen 3 small spikes, and those are after the 3 major holidays we've had. And I think there's I understand why people are hesitant. But we're doing this for the right reasons. We're doing this to prevent the spread of coronavirus. And we can't do it effectively without the help of the people that we're calling.
Okay, Maggie Kent of 6ABC has a follow-up on the contact tracing. She asked basically the same question Jim did, but with a follow-up in explaining how the contact tracing work is done. How is it affected by a delay in receiving test results?
Yeah, I think I said this early on the call. If someone goes to Quest and we don't get the result for 11 days after they get the test result, because we don't know about these people until we get the positive result. In most cases, some cases we know if they're household contacts, we can sort of do a little bit of preliminary contact tracing. But if someone just gets tested for whatever reason and we don't get the result back for a week or 10 days, by that point, anyone that they had contact with, a lot of times has already done things. They've maybe already gotten sick already. So it is actually important that we reduce the laboratory turnaround time for contact tracing. Now, some people we were able to trace right away because they gave us the name of a household contact, and we can act, on a lot of it. But there are some situations that have occurred where if we don't find out about a case for 10, 15 days, again, sometimes that person is already perfectly fine. By the time we find out about their case, they are already they're back to work. They can go back to work anyway. So it's but again, that's the exception, not the rule. And if that was starting to happen on a regular basis with all of our results coming back 10 days later, it would be a big problem. Yes.
And another follow-up on that question from Jim Melwart. Do you have any recommendations on where people might get tested and get more prompt results?
Yeah, obviously, emergency rooms, and I'm not telling people to go to emergency rooms just to get tested. I mean, I'm saying if you're actually very ill, an emergency room is an appropriate place to go. There's a couple of private labs, one near Oxford Valley Mall that gets results back fairly quickly. Sometimes people go to CVS and they get the results back in 2 days. Doylestown Hospital, for instance, has good turnaround time here in Doylestown. Some of the hospital settings in general have good turnaround time, but sometimes it's hit or miss. We have people that go to a location and get the results back quickly, and then sometimes someone else goes to the same location 2 days later and has to wait a week. It's a little bit hit or miss depending on the batch that gets sent. Sometimes, again, if you're sending those results, you're sending the specimens all the way to California, sometimes that batch gets delayed for whatever reason, and it's a little bit of a hit or miss. But there's some places to go in Bucks County to still get a result back, and we're hoping that starts to improve, because now that Quest knows there's a problem, Quest is working on actively reducing the turnaround time. And LabCorp, when they get overwhelmed, they know about the problem clearly, and so they work on lowering their turnaround times. Because for a while, LabCorp and Quest had very good turnaround times. So I think they just need, sometimes they get overwhelmed and they have to work on their processes to bring it back down again. So I do anticipate in the very near future we'll have better turnaround times everywhere.
Looks like our last question is from Frida Savannah of the Bucks County Herald on the same subject. Are test results at sites, and she mentioned CVS, where the person conducts the test themselves, are these considered accurate?
Yeah, the people, you're putting a swab up your nose. You're supposed to go far enough back to get it. There's some places that only do a swab in the anterior areas. It's right in the front of your nose, as opposed to go all the way back to your nasopharynx. There's certainly, the PCR is very sensitive, and it does pick up disease in most people. But the bigger issue isn't so much the swab, and that can be an issue, but it's how early in the disease you're doing it. This is one reason why testing asymptomatic people and people very early after an exposure to someone, when you test those people, you're going to get a negative result almost every time. And so that's one reason why having random people just be tested asymptomatically, or after they were just exposed to a case too early, that is, if they're not sick yet, you may get a false negative result. So that's more of an issue so much than whether you do it yourself or whether someone does it for you. Certainly, if someone does it for you, they're probably going to go further back in your nose than you do it yourself, because it's a little bit uncomfortable. But overall, I would not consider that to be a major problem at this point, no.
Okay, thanks, Dr. Damsker. That's all the questions I have, Commissioner. I'll turn it back over to you.
Well, thank you. I don't know if any of my fellow commissioners have anything to say. Any other comments?
I'm good, Diane. I think we covered a lot of ground.
We did.
Pretty well.
Bob sounds like he's good. And so we will see you again. Thank you very much. Thanks for getting the word out about asking people to stay safe and get those masks on.